Dr. Robert Lelouch, board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about how we can reduce the occurrence of urinary tract infections. So if you've had one or more, you certainly have every interest in figuring out how to avoid it from now on. This is a pretty broad topic, and one of the first take-home messages I want you to get is you should not be having regular urinary tract infections, and if you are, you need to work with your provider to figure out what's going on and see if that can be prevented, vastly reduced, or eliminated. I wouldn't tolerate regular urinary tract infections because there is always a way to get you in a much better place. That being said, there are a few things you can do that might universally apply. One of them is obviously to have good hygiene, take a shower after you exercise, after you get dirty. The urethra, the tube that goes from your bladder to the outside world, is much shorter in women, and so bacteria can get in there easier. And plus, normal women have bacteria in their vagina that's normal and healthy, and those can get pushed into your urethra. So one of the ways to reduce urinary tract infections is to recognize what would cause the bacteria to go up inside your bladder, and one of the most common causes is having sex. So if you have sex, you want to try to go pee to void after you have sex. You don't have to pounce out of bed the second, but I probably wouldn't fall asleep and go through the whole night until the next day. So, and staying adequately hydrated, drink enough fluids, so that if you're drinking enough fluids when you have sex, then you'll have the desire to go to the bathroom, and I would definitely go to the bathroom. So add that hydration. If you're having alcohol, that can dehydrate you and also encourage you to fall asleep and not empty your bladder. So alcohol, sex go together, passing out or falling asleep without getting up and go to the bathroom, all combined together. So when you're drinking some alcohol, also match it with some drinks, some fluids like water, or and that will encourage you to urinate. So that's very helpful. After exercising, be aware of staying in the same clothes for a while without changing your clothes, without showering. I encourage, if you're having episodes of recurrent urinary infection, that you stay away from baths and use showers instead. I recommend Dove soap, not perfumey soaps or heavy antibacterial soaps, unless of course you've been gardening or something where you need to really get some of the dirt off. If you're going to take a bath, take a shower first, get cleaned up so you're not soaking in perfumey baths or in your own dirt. Again, plenty of women do fine with baths, but if you're having urinary tract infections, it's time for you to kind of restrict things down. Also, be careful about following up on when you have a urinary tract infection on a culture so that you get the correct treatment. When you get a urine test, it's a preliminary test. They actually have to grow the bacteria, and that's a urine culture, and it can take 3, 4, 5 days to grow and to determine, yes, there is in fact an infection, and that it is a certain type of bacteria, and here is the appropriate antibiotic. So follow up on that, follow up on your care. Be careful about getting easy access to antibiotics without any follow-up on what the actual bacteria is. If you're having recurrent urinary infections and you go to multiple outpatient settings, multiple providers, then you may actually be getting treated with the wrong antibiotic for the same infection repeatedly. Or you may actually have a vaginal irritation that's irritating the out part of your urethra, and you don't even have a urinary infections. I have plenty of patients who've been referred to me for recurrent urinary infections, and then when I look in their cultures, every one of the cultures came back showing normal vaginal flora, meaning not having a urinary tract infection, but they have irritation, and they needed what's called a wet prep or an analysis to look for something called bacterial vaginitis. You can see the other video I have on bacterial vaginitis. One of the things that you might end up getting if you get recurrent infections is to get preventative antibiotics when you have sex, that we usually use nitrofurantoin, which is an antibiotic that concentrates in the urine and doesn't affect the rest of your bacteria, the normal bacteria in your body, because if you keep getting antibiotics, you start killing off the nice healthy bacteria. You overgrow the more resistant bacteria that don't respond to antibiotics. So be careful about just reflexively just getting antibiotics from somebody who calls it up without being seen, without getting a culture, and you can help avoid getting into that trap. In fact, some of the women, more often than not, the women that I see who have recurrent urinary tract infections are often in the healthcare field, nurses, pharmacists, physicians who have easy access. They skip some steps, they take antibiotics, and then all of a sudden they start having recurrences. There can be also some other issues going on, like kidney stones or other things that keep things going. So as you can see, it's a big topic. So I'm going to wrap up this talk and tell you, do not tolerate many recurrent urinary infections. I would say more than one in a year, and you should really start having a discussion with the same consistent provider to be able to figure out what's going on and what you can do to reduce or eliminate them. I hope you found this information of use. Please leave your comments. Thank you.